Hi, Dr. Bobby Stanley with Stanley Institute. I want to continue the conversation about helping your patients to say yes to Invisalign. We will be talking about how to wow the new patient. In the last presentation, we talked about marketing and how marketing was educating, and we talked about how to market to our patients externally. Now we're going to talk about internal marketing and presenting to the new patient. So the new patient is ready to say yes to Invisalign, because it's all about impressing that new patient and helping them to see that you are the dentist that they want to be with and that this is the right office for them. I think it's important that patients feel comfortable in our office. So a new patient visit should be welcoming. You should have someone to greet them, and an office tour may be something that's really pleasant for them. One thing we know is that when people know where the restrooms are, they feel more comfortable. No joke. So if you can present to the patient and show them around the office, part of showing them around the office is showing them what you do. For instance, patients don't know what you do. So if you had a sign like this in your office that says, "We do braces and Invisalign," how much would that tell your patients? The other part is when patients go on a patient tour in your office, it allows them to see patients that have had that type of work done in your office. So having a wall with photos that say these patients had Invisalign is so important, because it just helps reassure the patients that they're in the right place. It also gives them a sense of home because they see the office, they feel comfortable in the office. And then also it gives you an opportunity to show off your credentials, because doctors, you should have all of your credentials, your certificates, your continuing education certificates, any awards. Those should be all displayed for patients to see, not hidden in your private office. Put them out front so patients can see them, because you should be proud of them. Your patients will be proud of them. When you invite your patients in, you want them to be comfortable. Why not offer them a comfort menu? Something that says, in this office, we have high-speed internet. You can give them a private password for the internet that's not on your secure network. You could offer them noise-canceling headphones or a warm blanket, refreshments, and it could go on, towels at the end of the service. If you had all these on a menu and you passed this to the new patient and you said, "This is our comfort menu. Is there anything on here I can offer you today to make you more comfortable?" And if the patient said, "Gosh, I've never had this before, but every time I go in a dental office, I'm cold." Great, let me get you a warm blanket. As a matter of fact, I'll put a note on your chart that tells us that every time you come in, you'd like to have a warm blanket. What would that tell your patients about how much you care? So why not offer them a comfort menu? Also, take the time to get to know your patients. As doctors, it's so easy for us to go in and say, "Okay, welcome to our office. What are you here for today? Are you having a problem with your teeth? Oh, I hear you came in for Invisalign." We need to stop and get to know the patient first. So if you could take 4 minutes, just 4 minutes, to get to know the patient and who they are, because it's important to seek first to understand, then to be understood. That means that you have to relate to your patient. You have to ask them about who they are as a person and get to know them as a person before you get to know their teeth. And that's so important to people these days. One way to be able to get to know your patient and their teeth without being so invasive is iTero. And I will tell you guys, it's no secret, I am a huge fan of iTero. When I see a new patient, I will go in and I will ask them about themselves. I'll ask them about their family, what they do for a profession. I'll ask them if they're new to the area. There are just certain questions that I want to know to get to know the patient. And then I'll say, "Okay, that's great. Tell me more about what brought you into the office." And they may say, "Well, I just came in for a new exam." Great. Let's look at your teeth together. Before I go in the room, the teeth have already been scanned. I'm going to sit shoulder to shoulder with the patient. The iTero is going to be in front of me with the patient beside me, and we're going to walk through that scan tooth by tooth for the patient to be able to look at their teeth and understand what's going on. One thing that happens is that patients are wowed by that. They say, I've never seen technology like this before in an office. And I'll show them, I'll say, down in this screen here is what your teeth look like in your mouth. It's just a camera view. Up here is an infrared image of your teeth. And that infrared image will show us if there's decay between your teeth. And if I see that, I'll point it out for you to be able to see that. And patients are so amazed by that. We have our iTeros sitting out in the open so that when patients are on tour through the office, we have the ability to stop and say, oh, this is a scanning device that we can do a scan in your mouth, so we don't have to do those old-fashioned, yucky, mushy impressions. Everybody remembers those old-fashioned, yucky, mushy impressions. Nobody wants to do that ever again. So when they know that you can take a camera and just take a view of their teeth without having to get a mushy impression, it really says things about how advanced your office is. And if your office is that advanced, then obviously your skills are too, and that's where patients want to be. When you sit down and you show people the NIRI image and you show them decay, I mean, you can look at these images and you can see that decay, and you can look on the x-ray and it's not as noticeable on the x-ray, but when you see that white part in the interproximal area of the tooth, you know that's decay. And I'll say to my patients, you see that white area there? That's a cavity. And they'll say, oh my gosh, yes. And then we'll scan on and they'll say, oh, is that a cavity? And you could say, yep, another cavity, or no, it's not, depending on the situation. But when the patient starts diagnosing their own issues, it's a win for all of us. The other thing is that a patient may have issues like calculus in their mouth, where you can show them the calculus and they can see that buildup. And that goes a long ways to them understanding, because they're not looking in their mouth with a mirror. They're not looking in their mouth with a camera. So being able to show them that this is what's going on in their mouth, now they understand why you treatment plan them for scaling and root planning. The other thing that can happen is you can show people wear on their teeth. If you look at this image and you see on the mesial cusp of the first molars, you see that wear. This is truly a patient who came in 6 weeks after a filling was done on tooth number 19, and she said, you did the filling on tooth number 19 on the occlusal surface, and now there's a pit that you caused a pit. And I simply said, okay, let's pull up your last image, which happened to be from 2021, and I pulled it up, I showed her this image, and I said, oh, you see that pit? Is that the same area? And she says, oh, yes. Okay, it was there last year, it's there now after our filling. However, thank you for pointing that out to me. Let's talk about that, and now we can address that issue and what's causing that and how we can correct that, because the patient has now noticed that. So there are many things you can do with the iTero. The number one thing that I love about iTero is showing people how crowded their teeth are, because they see it from a facial point of view, and it's not that big of a deal. But when I click on the arch and I drop that arch and look at it from the occlusal surface, and I say, see this crowding here? Does that bother you? And they say, well, it's been like that my whole life. And then I'll say, let's look and see what it would look like if we corrected it. And I hit the simulator and I allow it to start simulating in front of the patient. And I'll say to them, I'm going to look at your x-rays for a minute. Let me just let the computer do what the computer's going to do. So I step away. Oftentimes, I've already looked at the x-rays, but I'm just giving them time to see the computer work its magic. And when it pops up a before and after, and I drop that arch down and I show them how straight those teeth can be and how easy it's now going to be to clean around those teeth and what that means for their health, that's really eye-opening to a patient, because they've never seen it from that point of view before. So it's so important to use technology, and I just think iTero is one of the number one technologies for wowing your patient. Now we've been able to wow our new patients with our office, with our technology, to be able to show them their crowded teeth and what it means for them as far as their function and their health, and also the aesthetics of it, allowing them to see what we do in our office, that we do Invisalign. Now we're going to move forward and talk about how our team can get involved.